Dissociative disorders, types, symptoms, diagnosis, and treatment. Introduction. Dissociative disorders are a group of mental health conditions characterized by a disconnection from one's surroundings, actions, thoughts, physical sensations, and even identity. They typically arise from trauma, often from early childhood abuse or neglect, and serve as an adaptive response to negative experiences. This video provides an overview of dissociative disorders, their types, and treatment options. Everyday dissociation. Many people experience brief episodes of everyday dissociation, such as driving on autopilot and not remembering the details of the journey. Typically, individuals can quickly snap out of this daydream-like state when their attention is required. However, for some people, dissociation is more pervasive and impacts their daily functioning, leading to a dissociative disorder diagnosis. Types of dissociative disorders. Dissociative disorders are categorized into three main types: Depersonalization/Derealization Disorder, Dissociative Amnesia, and Dissociative Identity Disorder. These disorders fall along a spectrum of severity, with depersonalization/derealization being the least severe, dissociative amnesia in the middle, and dissociative identity disorder being the most severe. Depersonalization/derealization disorder. Depersonalization refers to a feeling of detachment from oneself, while derealization refers to the perception that the world around is not fully real. Symptoms include emotional or physical numbness, a weak sense of self, and difficulty forming relationships. In severe cases, affected individuals may struggle to recognize familiar places, people, or objects, and experience altered perceptions of time, brain fog, and increased anxiety. Dissociative amnesia. Dissociative amnesia involves blocking out or forgetting important personal information that most people would remember. This disorder can be divided into four subtypes: localized, generalized, systematized, and continuous. The memory loss may be related to specific traumatic events, certain categories of information, or ongoing experiences. Dissociative Identity Disorder, DID. Formerly known as Multiple Personality Disorder, DID can be classified into two types: covert and overt. Covert DID involves sudden and dramatic shifts in perception, thinking, or feeling, while overt DID involves the assumption of two or more distinct identities, also known as alters. The prevalence of suicide among those with DID is alarmingly high. Diagnosing dissociative disorders. Diagnosing dissociative disorders can be challenging, as symptoms can also be seen in substance intoxication, seizures, brain trauma, and chronic conditions like dementia. Psychiatric conditions like anxiety disorders, bipolar disorder, and schizophrenia may also present with similar symptoms. Treatment for dissociative disorders. Psychotherapy is the primary treatment for dissociative disorders, helping individuals process their trauma safely. In the case of DID, the goal of therapy is to facilitate the fusion of identities, integrating the personality states and helping the person feel more whole. Conclusion. Dissociative disorders arise as an adaptive response to severe or prolonged trauma. They include depersonalization/derealization disorder, dissociative amnesia, and dissociative identity disorder, each varying in severity. Proper diagnosis and treatment through psychotherapy can help individuals manage their symptoms and improve their quality of life.